Hello, and welcome to Teach Out Security Solutions. My name is Ian Thomas, and I'll be your instructor today for infection control. Health System Infection Control Mission. Reduce the risk of transmission for infection control and prevention. Provide a safe environment for patients, associates, and volunteers and visitors. How can one department handle infection control for the entire health system? Infection control is everyone's job. Basic infection control principle. Containment. Break the chain of infection. Bloodborne pathogens. Disease-causing organisms found in the human blood and some bodily fluids. Bloodborne pathogens. HIV. Hepatitis B virus. Hepatitis C virus. HIV. Many infected people are unaware that they have or carry the infection. There's no vaccine or cure, and the virus attacks cells of the immune system. Weakening the immune system leads to acquired immune deficiency syndrome, AIDS. Hepatitis B virus. Found in blood, saliva, and other bodily fluids. Flu-like symptoms. Causes inflammation of the liver. It's a major hazard. 10 times the risk of contracting HPV from bodily fluids than HIV. Vaccines are available. Hepatitis C virus. Most common bloodborne infection in the USA. Many infected people are unaware that they carry the infection. 60 to 70% have no symptoms. There's no vaccine available. 75 to 85% of people who develop the long-term infection, HCV, associated with 10,000 deaths per year. Standard precautions. Treating all blood and bodily fluids as if they are infected for something. Steps to take to lower your risk for exposure to bodily fluids. Apply to all healthcare workers at all times. Originally called universal precautions. Standard precautions. Assess the situation and protect yourself. Wear gloves when in contact with bodily fluids or non-intact skin may occur. Wear a mask if your patient is coughing. Wear eye protection and a gown if splashes are likely to occur. Expanded precautions. Transmission-based to stop the spread of infectious organisms. Wearing specific personal protective equipment, PPE, for each type of expanded precautions. Designed to break the chain of infection and contain the organisms. Expanded precautions. Contact precautions. Gloves and gowns are required to enter into the room. Droplet precautions. Masks are required within 3 feet of the patient. Airborne infection isolation. N95 fitted masks or PAPR, positive air pressure respirators, required to enter into the room. Current sign for contact precautions. Current sign for droplet precautions. Current sign for droplet precautions continued. Current sign for airborne infection isolation. Current sign for pregnancy precautions. Vaccinations. Protect yourself by being up to date with your vaccinations and knowing your immune status for the common vaccine preventable diseases. Vaccinations. Hepatitis B vaccine. It's a 3-shot series. No booster recommended. Vaccinations continue. Influenza. Yearly from October to March. 1 shot each year at the beginning of the influenza season. Protect yourself and your patients and your family. The important to know your immune status for measles, mumps, rubella, and chickenpox, and get vaccinated if necessary. Exposure follow-up. Bloodborne pathogen exposures. Tuberculosis. Other exposures. Exposure follow-up. What should I do? Wash the exposed area immediately unless life-threatening. Report to a supervisor. Complete an incident report. Contact the facility for infection control and employee health. After hours, contact your nursing supervisor in the emergency department. Emergencies, report to the emergency department. Write an incident report. Contact Teach Out Healthcare Division Management. Biohazard waste. Red bags, biohazard waste examples. Items soaked with blood, IV tubing with blood, used cultures, tubes, or swabs. Sharps containers, 1 3/4 full and locked. Items for sharps. Needles and scalpels or syringes. Why do we wash our hands? Washing our hands is the single most effective way to reduce the risk for healthcare-acquired infections. Has been adopted as a 2004 National Patient Safety Goal. Joint Commission for Healthcare Accreditation, JCAHO, requires compliance with the Center for Disease Control hand hygiene recommendations. Hand washing guidelines. Don't give germs a ride. Remove jewelry to clean underneath. Wet hands and forearms with water and place a dime-sized amount of liquid soap on your hand. Wash for 15 seconds, paying close attention to your nails, between fingers and sides and tops of hands. Hand washing guidelines. Rinse completely with water. Completely dry hands with a paper towel. Use the paper towel to turn off the faucet. These guidelines are for healthcare personnel. When do I wash my hands? Before and after work, before and after contact with a patient or their environment, after handling soiled equipment or linens, before and after using the bathroom, after glove and protective equipment removal, after hand contact with blood or other potentially infectious materials, whenever hands are soiled. Hand disinfecting alcohol-based hand rubs. Inspect your hands for visible soiling or dirt. Wash your hands with liquid soap and water if visibly soiled. Squirt a dime-sized amount of liquid into your hand at the palm of your hand. Rub your hands together, paying close attention to your nails, areas between your fingers, sides, and tops of hands. Let it air dry. If your hands have cuts or hangnails, use lotion to heal your skin before using alcohol-based hand rubs. You may only use these products if your hands are not visibly soiled. Hand washing with liquid soap and water remains the gold standard. Thank you.